So good evening, everyone. Thank you for joining us today. We are here to discuss navigating treatment of kidney cancer. This month, March, is Kidney Cancer Awareness Month, and we've been running a series on this topic. And we really want that patients and their family caregivers should not fear cancer and specifically kidney cancer, but should understand it better. Today, we are very privileged to have Dr. Uma Dangi, who's at consultant medical oncologist at Fortis Hospitals in Mulund, and Dr. Mithun Shah, who's consultant medical oncologist at Zydus Cancer Center in Ahmedabad. Uh, they are our guests tonight and our experts, and who will be telling us about kidney cancer and how you can navigate the treatment options available. A quick reminder, PatientsEngage is an online platform for patients dealing with chronic diseases and their caregivers to share their own personal experiences, learn from each other, learn from healthcare professionals, and make better informed decisions on a day-to-day basis. Our objective always is to inform, engage, and empower patients and caregivers. And what we really want is that people should know that they're not dealing with this alone. We've always put patients and survivors at the center of all of our conversations, and it's through our hundreds of conversations with patients that we understand the gaps in the information they have and what they would like to know better. Uh, so previously, this is part of a series we've been running, supported by Pfizer and Merck. And previously this month, we've talked about kidney cancer signs and symptoms in both English and Hindi, and you can find those recordings on our YouTube channel. And not tomorrow, sorry, Wednesday, we will be talking to Dr. Aditya Murli and Dr. Srinath Bharadwaj on living well after kidney cancer. So let's get started. As I said, we are here today with Dr. Uma Dangi and Dr. Mithun Shah, and I'm Aparna Mittal. I'm founder of PatientsEngage. A quick reminder that this session is supported in public interest by the Merck and Pfizer Alliance, and it's only meant for educational purposes and public awareness. The session does not replace a medical consultation, and the views expressed are only for spreading general awareness and may not always reflect that of the platform or the sponsors. If you are watching this live, you can post your questions on Zoom or Facebook or YouTube, and we will pick them up. Or you can reach out to us on any of our social media channels: Facebook, Instagram, Twitter, YouTube, LinkedIn, or through our website, patientsengage.com. So let's get started. Thank you once again, Dr. Uma and Dr. Shah, for joining us. Dr. Uma, can you start by explaining what is kidney cancer? Just a reminder to our audience so that they know what we're talking about.
Thank you so much, Aparna. I'm very happy to be here. Thank you for inviting me. So kidney cancer. So cancer is a growth of cells which is uncontrolled, and it continues to grow and spread because there is no control over that particular growth. Now, this can affect any part of the body, and when it affects kidney, so kidney is also like any other organ made up of cells, and when these cells, because of stress or for any other reason, undergo certain changes which give them sort of a growth advantage, leading to multiplication of these cells and formation of tumors. And this is what is kidney cancer mainly. And the thing is that it can grow and it can spread to other organs as well.
Thank you. And Dr. Shah, what are the signs and symptoms that people should watch out for as far as kidney cancer is concerned?
Usually, the kidney cancer is a very slow growing tumor. So majority of cases, it is picked up on incidental basis. So for example, the patient goes for some other symptoms, pain in abdomen and all, and there is an incidental kidney mass. So majority of will have such kind of symptoms, some means no symptoms to begin with. But when the kidney tumor has begun to enlarge, so the patient can have hematuria, that is blood in the urine, and he can have some pain in the abdomen. Other symptoms because of the indirect spread of the cancer can be because of pain. If it has spread to the bones, he can have pain, back pain. His hemoglobin may be low. And he may have some distant spread symptoms like brain met. If he develops some brain spread of the cancer to the brains, he may develop headache and all. So it depends whether it is localized or it has spread. So the symptoms may vary.
Right. Thank you.
I can add to that. Sometimes,
Sure.
these patients can present with a very high hemoglobin also. And a lot of times when we are investigating for high hemoglobin, we do ask for an ultrasound or, something like that to rule out if there is a kidney lesion. So some, like what you call as polycythemia. So that can also be a presenting feature of a kidney cancer.
Thank you. And since you were talking of tests, Dr. Uma, what tests are used to diagnose kidney cancer?
So usually it like Dr. Shah rightly pointed out, many times it's an incidental diagnosis where an ultrasound has been done for just a general checkup. So if there is something in the kidney, then the usual test that we do ask for is a CT scan. And if it is a localized tumor, we usually refrain from doing a biopsy because it can actually upstage the tumor. So what we try to do is we look at the scans and try to figure out how big it is, or how if it is more than a particular size, then you want to get it out. So then the only way to do is to remove it surgically and send it for testing. In case if sometimes it is a widespread disease, or it has gone to the bones or the lungs or anywhere else, in that situation, when the stage is already up, then you want to do a biopsy to kind of find out the types, because even in kidney cancer there can be different subtypes. It can be clear cell, it can be papillary, it can be sarcoma. So there are different types, and probably the treatment would slightly differ depending upon what histopathology it shows. So in such situations, biopsy is very important. But yes, in localized tumors, we don't really go ahead with biopsy. We try to do the surgery first.
Okay. And is there any blood test or urine test that would give any, indication or markers?
No, so there is no blood test. There's a lot of interest in circulating tumor cells recently, but it has not really been validated for kidney cancer. Now, there is another type of cancer. This is not really kidney cancer, but even in the kidney, there is what we, where the urine is formed and the urine comes down into the bladder. So there is what we call as a pelvic allysial system where the urine is, is collected. So in that area, sometimes you may have what we call as urothelial type of cancers, not really a kidney cancer, but still. And sometimes they can be detected by urine cytology, but that is a very rare thing.
Right. Thank you. Thank you, Dr. Uma. So Dr. Shah, Dr. Uma kind of alluded to staging a little bit, but if you can describe for our audience, what are the stages of kidney cancer?
Yeah, that is a very common question. The patients come up because they have heard about the staging, like 1, 2, 3, 4. They know it everywhere. So tell me my stage. That is the first question they come up with. So generally, it is simply the stage is the stage where you detect the tumor, and stage 1 is a small tumor to begin with. They have cutoff is around 7 centimeters. Less than 7 is stage 1. Stage 2 is more than 7 centimeters, but both are localized to the kidney. Stage 3, it has spread to the adjacent organs like the major vessels which go through the kidney or adjacent adrenal gland. And stage 4, it has spread to the distant organs like lungs, bones, brains, and some nodes, liver. So that is stage 4. So that's how the 4 stages of kidney cancer.
Right. And Dr. Uma, you said that if it's early stage, surgery is typically the best option. So in which case, only the disease part of the tumor is excised, or the whole kidney needs to be removed?
That's a very important point that you've suggested. So typically, if it's a large tumor, and like Dr. Mithun Shah explained that, if the vessels and all are involved, then it may be difficult to save the kidney, and what we call is a radical nephrectomy, where you remove not only the kidney, but the tissues surrounding it as well. But sometimes if the tumor is smaller, or if it is only restricted to one pole of the kidney or one part of the kidney. Sometimes a nephron sparing surgery or a partial nephrectomy is possible, but the patients have to be, like really selected carefully by the surgeon who's going to operate.
Right. Thank you, Dr. Uma. And Dr. Mithun Shah, what are the other treatment options that are available for subsequent stages, or do you also have cases where even if it's an early stage after surgery, chemo is required or things like that? So if you can talk about the treatment options.
What has been said by Dr. Uma is like for localized tumor, surgery is the treatment of choice. In very small tumors, we just remove the partial kidney, which is called as the partial nephrectomy. If the tumor is large, then it is radical nephrectomy. If the tumor has spread beyond the kidney, and then the major treatment is like there is some oral pills to it that we call it as TKI inhibitors. So there are oral pills, and the latest treatment for it is now is immunotherapy.
Right.
So to begin with, if it is a spread out disease, then there is not much chance, there is not much importance of removing the kidney nowadays. We can directly go to a treatment with a combination of immunotherapy and oral TKI. So it depends many a times how much is the affordability of the patient, but there is there is a good chance that the patient will have a control of the disease when we give these drugs, and they are very safe and effective treatment options nowadays which are available for these kidney cancers. If we see 10 years back, 5 years back, there were hardly one or two pills, and now there is a plethora of options for this kind of tumors.
Okay. Yeah, so I think we did talk a little bit on this, but I think that's another following question as well is, how has kidney cancer treatment changed over the years? And Dr. Uma, if you can talk about that and how it has impacted survival rates as well, because I think we often find that, there's a certain category of patients will say, okay, my uncle had it and he did not live long, and then they don't go ahead for treatment. So I think it's important to recognize that what happened 10 years ago or 15 years ago is very different from now. So if you can kind of talk about how kidney cancer treatment has changed over the years.
Certainly, it has changed a lot, and like Dr. Shah, pointed out that we had only a couple of pills, maybe certain different kinds of immunotherapy available a few years back, and now we have like a whole bag of drugs which we can give in various kinds of combinations. And certainly, if you look at the data, the pre-pill area or the era or the pre-TKI era, what we call tyrosine kinase inhibitors. And the post, there's definitely an improvement, has been an improvement in the survival of patients. And people, I feel it's more becoming a chronic disease rather than, even if it is not curable, we are giving them treatment, first line, second line, third line, and people are living longer with a good quality of life, not compromising on the quality, but we're still living longer with a good quality of life. So that also has, I think, played a very important role. Even if cure is not possible, still you can have a good quality of life and good longevity of life.
Right. And Dr. Mithun, when doctors talk of first line, second line, third line of treatment, what does that mean to a layperson?
See, first of all, I would like to say that for kidney cancer and as such, the most important parameter is disease biology of the disease. When we see a kidney cancer, the disease biology may be so slow that we have seen few patients living for years. Even for first couple of 6 months or 12 months, we can just observe them. So the message should be that each cancer behaves differently, the biology is different, and as per the patient's tumor, general condition, economical condition, we plan the treatment. So this first line is the treatment which we think we may not go by the textbooks, we may not go by the Western literature, but our own experience, Indian experience, we can start them with the first line treatment like oral tyrosine kinase inhibitors and immunotherapy. If they are affording, we can add immunotherapy plus TKI inhibitors, or we can do it sequentially. So whatever treatment you have written first is the first line. If they fail
Right.
on that or progress on them, then we receive the second set of treatment, that is second line. And then the whole journey and the progress of the patient is been monitored.
Right. And when you refer to biology of the cancer, what does that mean?
Biology means the behavior of the cancer. This kidney cancer is unique in a way, like if the patient has been operated for a nephrectomy some 8 years back, he can fail after 7 years also. So
Hmm.
then that subset is a good subset. Who fails late, who have few limited meds, they do well with tablets. I have a patient who has done well on only tablets for last 7 to 8 years, and then he progressed. So that
Right.
falls in a good subset of the patient, where you
Right.
really don't need to push in drugs and this. You can go slow on the treatment.
Right. Right. Um, and Dr. Uma, can we talk a little bit about, that we've talked of various treatment options, but if you can kind of talk about the broad side effects of the various treatment options, and
Mm.
again, how the management of these side effects has changed over the years.
Yeah, so the side effects depend again upon what drug you're using. So these TKIs generally they have a lot of lethargy. Some of them have diarrhea. Many of them inhibit the blood vessel formation. So it can cause bleeding. It can cause increased risk of clots.
Hmm.
Like immunotherapy has a different set of side effects. Like it can because it's the way it works is that it stimulates the body's immune system to fight the cancer cells. So when the body's immune system is stimulated, it can also attack your own normal cells. So which is what we call as a sort of autoimmune side effects, and it can affect any organ. So it can cause hepatitis, it can cause colitis, it can cause pneumonitis, it can cause thyroiditis, anything. So any organ can be affected, although the incidence is small and the severe incidence is even smaller, but these are it can cause rashes. So all these are the common side effects that we deal with. And based on the severity of the side effects, definitely there are management guidelines on how to interrupt the dosing or change the dosing, or reduce the dose, and all these things, and the monitoring. Some of the TKIs can also cause what we call as QTC program, changes in the cardiac rhythm or ECG, so which we have to monitor during the treatment. So it's not very simple, but I would say that definitely the supportive care that we have currently has improved, and it's much better than what it was few years ago. So these side effects are usually easily manageable in trained hands, and one should not get treated because they're worried about the side effects, and that's what usually happens, because everybody's worried so much about the side effects that they don't realize what will happen if they don't get treated. So I
Hmm.
think side effects are easily manageable, and you have to focus on the treatment as well.
Right. And in terms of side effects, is is there pain and weight loss as well that comes in, or that's more the complication of the cancer itself and not
It's
a side
more
effect?
of a complication of cancer, the pain and the weight loss, but sometimes a lot of patients can have this nausea, change in taste,
Hmm.
and so their eating habits change, or they're not able to eat well, which can lead to weight loss in some patients, but the drug per se itself will not cause weight loss.
Right, right. Okay. Um, and I know you said that now there are better supportive care options. When do you recommend that patients come back? And this is to you, Dr. Mithun, because often we find that patients don't have a very clear understanding of when they should report back to the doctor about a side effect, right? So they will try all other methods. They will go ask somebody else, but they may not always come back and discuss with the doctor that, this is a side effect I'm struggling with. So how do you advise your patients as to how to figure that out as to when they
See,
should
if the
come back and
patient is
discuss the
on
side
oral
effect?
treatment,
Go ahead. Go ahead.
the patient if the patient is on oral treatment, the first follow up is after a short interval around 3 weeks. We call the patient to know what are the side effects. We try to explain them all the side effects, give all the preventive measures, like there is some pigmentation of the skin, do not get frightened of it. You may have mouth sores and all. We try to explain, give the supportive medicine. So
Hmm.
the first follow up is around 3 weeks, And then every 2 to 3 months, we keep the following the patient. That is both to know the effect and the side effect. So our first response assessment is around 3 months time from when we start the treatment. So every 3 months, we try to do some kind of ultrasound or a CT scan to know the response rate. If it is an injectable treatment like immunotherapy, every 15 days or 3 weekly we meet. So for injectable treatment, it is very easy to monitor. And plus, they have the hospital helpline, or everything is been given to them. So in emergencies, they should see the doctor. And I would like to say that even they should keep the general practitioners in touch, because every time for reaching a simple problem may be not be advisable. So they can take the initial remedies with their family physician to begin with.
Right, right. And also because some of these cancers affect older people, they may have other conditions as well, right? So they may have diabetes, or they may have a pre-existing heart condition. So how do you, how do you advise them to manage the combination? And this can be to either of you, Dr. Uma or Dr. Mithun. How should they be managing both the cancer as well as those treatments?
So
Go ahead,
Generally,
Dr.
yeah.
Uma.
both the treatments are
Okay.
different. So our first thing is that we tell them that
No, go ahead, Dr. Mithun. It's fine. We'll ask Dr. Uma to
yeah,
go
the
ahead.
patient we can yeah, the patient, if it is given patient has been told that he should continue the previous medicines, there is generally no much interaction between the two drugs. So the first thing is that you continue all your previous medicines. And if you report some other side effect, like some pills can cause rise in the blood pressure, some may cause a low thyroid function. So that has to be monitored, and the dose of the medicine has to be adjusted. So the physicians, we generally tie up with the physicians who is their own previous treating physician. So they can talk with them and adjust the dose of few medicines.
Right, right.
Otherwise, the previous conditions treatment remains the same.
Okay. Because we've had some cases where some treatments also affect the blood sugar as
So
well.
when you're choosing the treatment, you always look at how the patient's general condition is, what are the comorbidities, and what kind of will best suit that particular patient. And based on that, and you obviously know the side effects. So if there is a drug which is going to raise the sugar, then you explain to the patient that you please monitor your sugars, or you monitor your blood pressure, and if
Right.
it goes high, you must come to the doctor, or you must go to the physician and get it controlled. So and stop the drug at that point in time. So all these instructions are very have to be given to the patient, and obviously monitoring has to continue. One doesn't stop doing that.
Right.
Simultaneously, both the treatments have to go.
Right, right. Thank you. And Dr. Uma, during the treatment itself, what are the lifestyle advice that is given to patients? Do you ask them to exercise more, exercise less? Do you ask them to change their diet? Smoking?
So bad habits should go away. That I obviously say, no tobacco. Avoid, and I don't really restrict too much, because many times, these patients have such an altered taste, they're not able to eat. So if you restrict the diet even within that, it becomes very difficult. Patient has not much to choose from. So I allow them whatever they want to eat, as long as it's healthy, it's hygienic, it doesn't interfere with their diabetes or blood pressure or anything. And and if they can exercise, because some of these drugs can sometimes cause a lot of fatigue. But if what I tell them is that if they are physically active, maybe limited, but still if they remain physically active, they can deal with the side effects in a much better way, rather than just being homebound. And in India, what I've seen is most of the caregivers are so protective that they don't go here, don't do this, don't do that. And it really affects the patient also very emotionally, because they feel like they're a cage. So it is very important to allow them to go out as well. And if they want to travel, we can travel, and we have colleagues all over the country, you know, so we always say, oh, you can go and discuss with, you know, if you're traveling and if you are in trouble, you can go meet my colleague there. So we can sort things out. So I don't really put too much restrictions on my patients. I
Dr.
don't know what
Shah,
Dr.
would you
Shah
want to
says.
add anything?
No, I think I agree. Besides the dietary measures and the routine food measures, they should be motivated to continue the treatment and give them the best advice, whatever we can.
Right. And given that their immunity is low during this time, do you have any other advice for them to stay, kind of safe from an immune standpoint, especially post-COVID awareness on, risk factors?
So I would say I usually tell them to avoid crowded places, not, you know, you can go
These
out in
are
open
not
spaces, gardens,
chemo.
and sorry. And you can wear a mask when you are out in public places, but and eat hygienic, like I said, you know, that's the best I think we can do for this. Dr. Shah had something to say. I'm sorry, I interrupted.
Yeah, I think he seems to have frozen. His internet connection is probably not so great at the moment. You're back. Dr. Shah, would you like to add anything? I think you got frozen a little bit.
No, I think these are not chemotherapy. These are not chemotherapy, so there is not much immunosuppression. There is not much neutropenia as such. So the routine vaccinations and avoiding the crowded places is what is minimum advice we can give. Otherwise, they can go on with their life and do the routine things.
Right, good. Thank you. So I think just a couple of final words from both of you, Dr. Uma. Any final messages to our audience?
So I think the only message I would give is it is important to get diagnosed early and diagnosed correctly, and there is no need to fear the disease, because cancer is something, it's associated with so much of fear that people don't want to do any tests because they're scared of what it might come out to be. So I think there are so many advances that you can still live your life, you can fight this, and you can live well.
Thank you. Dr. Mithun Shah?
Yeah, I think kidney cancer is one cancer where the curative options are there. So in early stages, surgery remains the cornerstone of the treatment. And since God has given two kidneys, it is not going to change your lifestyle much. And even if it is advanced stage with modern treatment, the median overall survival is going up. So don't give up. You should still see your medical oncologist, a cancer specialist in your town, and take their advice.
Thank you. Thank you so much, Dr. Uma Dangi and Dr. Mithun Shah. I think it is, as we've been saying throughout this month, and we will continue to say it as well, is kidney cancer is a very treatable disease now. So do not, as both doctors have said, do not fear, and see an oncologist, see a list, and get diagnosed early, get treated, and follow your treatment regimen. And I think the one thing that we do want to reiterate is that while you're going through the treatment also, I think families should stop being as protective about patients and allow them a little flexibility, because I think it is like, you need to stay upbeat, you need to have your morale up. So I think all of those, and it will make the life of the caregiver also easier if they just let go a little bit. So thank you so much, Dr. Uma
Thank
Dangi
you.
and Dr. Mithun Shah, and thank you,
you so
Pfizer,
much.
for supporting.
Thank you so
Thank
much.
you so much.